Um, okay. All right. So we'll start by talking about some of the common physical symptoms after brain injury. And then we'll introduce a strategy called pacing, which is a very effective method of managing physical discomfort. And then we're going to talk about sleep hygiene tips to kind of help with some sleep issues that are relevant to brain injuries. Then we'll transition to talk about how to manage some negative moods and thinkings that might commonly arise in rehab. And then we'll end our webinar by sharing some tips on preventing future brain injuries. And then at the very end, we'll finish with the Q&A. Okay, so for the past 2 weeks, we primarily focused on discussing what to do with cognitive impairments, which were outlined in the blue table here. But as we all know, brain injury comes with many physical and sensory symptoms too. So for example, some people may experience headaches, dizziness, fatigue, sensory changes such as blurred vision, sensitivity to loud noises and bright light, as well as other somatic pain or mobility difficulties. So pain can also come from dental issues or reduced fine motor dexterity. Now, sleep problems are also very prevalent in our brain injury survivors population. So a variety of sleep related issues could be difficulty falling asleep, having too little or too much sleep, or having fragmented sleep. We talked about having a feeling about feelings last time, so it's not surprising that one can also experience mood changes such as nervousness, anxiety, feeling irritable, and depression in the rehab process. So I have a poll activity here in the upcoming slide. Okay. So with that, we want to pause a little bit here and think about what physical symptoms did you notice after the brain injury?
Okay, and we've had a little delay on the poll activity, so I think we're just going to need to ask this one. And Liz, maybe you could read the list of symptoms there.
Yeah, okay.
Or I can here as well.
Yeah, so we have headaches, dizziness, fatigue, blurred vision, sensitivity to noise and light, and other somatic pain.
Okay, and maybe in this case, if those of you, I know this is a little different than we're usually doing it. We just had a little technical difficulty. If you feel comfortable writing in the chat, you can. Obviously, a little bit less anonymous, but even just kind of thinking to yourself, which of those physical symptoms did you experience? And then we can talk a little bit about, what people notice.
Yeah.
And just sort of in, and Dr. Choi, maybe in your experience, are there particular symptoms of those that are more common among the folks that you've assessed or treated?
Yeah, I can do that. I definitely say in my clinical experience, I think headaches and dizziness and fatigue, and fatigue are more of the more common complaints after TBI. And there are a proportion of clients who would also say that they have some changes in their sensory perception. So I think those would also be, things to look out for. So I think with this activity, once you think of a physical symptom that you experience or that's most salient after the injury, just keep it in mind as we go through the pacing strategy, because we'll be able to apply that with that strategy later. So let me move on to the next slide here. Okay, so very common questions that we were always asked by our clients is how long do these physical symptoms last or mood symptoms last? And our answer here is everyone appears at a different pace. And while this answer can be a little bit vague, we actually feel that it's more important to focus on what the risk factors that you have that may potentially lengthen the time to fully heal. So we gathered a few risk factors that can prolong one's rehab time, and these include pre-injury, what your emotional functioning is. Are there any pre-existing anxiety or depression? Were you sleep deprived before the injury? Were there any pre-existing cognitive issues already? We also look at age and medical history. So the older the age and the more complicated the medical history is, the longer it takes to do rehab. We look at the severity of physical symptoms because sometimes pain or vestibular issues such as like feeling dizzy or that lightheadedness, that loss of balance, these issues can really interfere with people's motivation to participate or resume normal activities as well. And lastly, we also pay attention to your emotional functioning after the injury. So, for example, any presence of acute stress or trauma reactions can cause us to freeze or avoid certain aspects of life, kind of making it harder to do rehab and to have a full healing process take place. And here we want to emphasize that rehabilitation is a multidisciplinary collaboration, and we as psychologists are only one member of a full team. So Dr. Adams and I listed kind of 8 specialties here that are commonly involved in rehab, and we kind of want to briefly introduce them. So if they're relevant, you can, take this with you and discuss with your doctors about possible referrals. So maybe I'll start with the first 3 here. So physiatry in the orange box here. It is also known as physical medicine and rehabilitation. It's a branch of medicine that aims to enhance and restore functional ability and the quality of life with physical impairments or disabilities. And physiatrists are the ones with the medical degrees. And then to the right, we have neuropsychology and clinical psychology. So neuropsychology is a subspecialty under clinical psych. So we study the brain behavior and the emotions together. And we look at how injuries or illness of the brain affect thinking and behavior functions. We do cognitive and psychological assessments to help inform psychotherapy and cognitive remediation. In the blue box, we have speech therapy. And really the goal there is to improve communication. They can do that by improving coordination of speech muscles, sound repetitions, imitations, and the way we comprehend conversations and language. So Dr. Adams, if you want to kind of walk us through some of the other specialties.
Yes, absolutely. I've had a little delay in internet, so if I completely drop off, I will join again. But just checking into a couple of them that have surfaced here. So occupational therapy, you did not mention that one, I believe, yet.
Yes.
So occupational therapy essentially uses a variety of tools, so assessment and other interventions to help really recover or maintain the activities most meaningful to you, to the individual, or that relate to your occupation, your everyday activities, or those in a group or a community. Some of the other ones up here to mention would be vestibular training. So the vestibular system is a sensory system that's essentially responsible for providing your brain information about motion, spatial awareness of your surroundings. It also helps with your balance, the ability to stabilize your head, know where your head is in relation to the rest of your body during movement. So when we have kind of the dizzy or nausea spells, it can be attributed to needing a little bit more attention to recalibrating the vestibular system. Other ones, neuro-ophthalmology is an arena used that to evaluate or treat any conditions where there appears to be an abnormality or a challenge within the brain causing a disturbance in your vision. So blurred vision, other misalignments that occur. And so within neuro-ophthalmology, you might find yourself practicing computer-based games or assessing your pre-functioning vision and what shifted for you. So the last one, I believe on here noted, culturally specific therapies and resources, for example, because I believe neuropsychology, that was mentioned, you mentioned that at some point in speech. So culturally specific therapies, and the idea there would be any resources that you have used, have been comfortable with, that are specific to your culture or to your orientation. So starting with culture, something that perhaps is healing, that you're culturally oriented through or religiously faith-based, that is supportive to you. As you know in the slide here, it's multidisciplinary. So the idea is kind of treating holistically the approach. And so anything that essentially allows you to resource back to either original functioning or a space where you even feel perhaps more supported in community or at ease in your own mind, which we'll get to more later. But the idea of resourcing yourself as specific to something that was useful to you before or something that has arisen as a need in your community that could service you due to this challenging time.
Thank you, Dr. Adams. And with that, we want to transition and talk about a strategy called pacing. So with pacing, it does not really treat the physical symptom, but it is primarily used as a way to kind of reduce interference of the somatic symptoms on our daily lives. So we do so by introducing rest and also a gradual increase of activity threshold in the body. So this is a graph, so this is not pacing, but this is a graph illustrating the unhealthy patterns of mismanaging our physical symptoms. So our body states can be divided into 3 zones: relaxed, the green zone; warning, the yellow zone; and the danger zone. And then the purple line here reflects our activity level. So you may notice that you sometimes work on a certain task, say you're doing work or doing chores, that kind of go beyond your current capability. So that's when the purple line starts to shoot above the relaxed zone, entering the yellow and red zone. And we passes through the symptom onset. So that is where the, for example, the symptom that you identified earlier could be the headache or the dizziness that starts to set in. So this is when the discomfort sets in at this point. Now, for some people, they only stop when they experience severe symptoms, so at the peak of this purple line. And then as the body depletes its resources or when the pain is too severe, we crash. Now, as a result, sometimes it may take us several hours or even days to recover from this. And to make it worse, sometimes when we don't notice, or sometimes when we do notice that the symptoms are starting to subside, we jump immediately back into the cycle and we don't stop until we reach the peak, the danger zone again. And now over time, you see that with the big fluctuations here, we experience a dysregulation of rest and activities. So what are we going to do with pacing? Now, for the purpose of recovery, we have to plan and pace the activities so that we function within the safe zone. So this requires us to do at least 2 things here. First is we want to set time restrictions for activities. So we want to stop, for example, we want to stop the activity 10 minutes before our max time and kind of use a timer to remind ourselves when to stop. So we're kind of like staying within the green zone here and not like shooting across the symptom onset, going to the yellow zone or the danger zone. And second is that in order to know when to stop, we need to learn to listen to the body and know what it's feeling in these 3 zones. So over time, your body and your brain kind of build that resilience and strength to tolerate more and more discomfort. And over time, it will be able to kind of engage in higher activity levels. So Yeah, so notice that like here with the purple line, it rarely hits the symptom onset. And sometimes like even if we do, it's okay. We won't be crashing. Like if you stop at this point, we won't be crashing like in the earlier graph. And so it's kind of easier for us to rebound and regain our energy. So I want to pause here for a little bit and let everybody kind of reflect on what it feels like to be in each zone. And we do encourage to kind of take this exercise with you and kind of process this with your therapist because it does take a bit of time and energy to kind of, and guidance to kind of know like what it feels like. So for example, a client of mine said that in her relaxed zone, she notices that her breathing was very steady, very slow, her hands were relaxed. And as she got closer to like a 5 or 6, she noticed that her fist starts to clench, her shoulders were like stiff. And then at 7, like her heart starts to beat like a lot faster, feeling a little bit disoriented. There's like some pain, like starting to feel tight around like the temporal regions on her head. So the key here is to learn to notice your own feelings internally and kind of make a stop at around 5 or 6 so we don't continue to escalate to the red region here. All right, looking at time here, I'm gonna move forward to the next slide. So we encourage you to bring this exercise to discuss with your therapist, as I said before, because you know, the way we grow awareness to body sensations, it takes time and guidance. As a start, it's always good to pick one symptom first as a warning sign. So for example, from my previous, you know, client's example, we use the tension on her head as a sign to kind of remind herself to take a break. You can also choose like one activity to practice this awareness and pacing strategies just as a start. We talked about banking our energy last time. So as a quick review, we want to review our calendars at least twice a day, morning and evening. So we kind of can pre-plan the day. We want to differentiate what we really need to do versus what we want to do so we can prioritize our activities. One thing that I like to do with my clients here is also to categorize activities by their intensity levels to different color zones. So for example, green can be a relaxing activity, and then red can be a more intense activity. Now we want to make sure that we don't have maybe more than 2 reds a day. You might want to pair a red activity with a relaxed green activity in a day to kind of, you know, even it out. And then next, I kind of want to talk about sleep too. So here's a little bit of stats to kind of ponder on. So according to some stats data, 30% of adults in the US actually endorse having insomnia symptoms. And then 10% of the whole population would receive a clinical diagnosis. Now, in the TBI population, sleep disturbances affect about 30 to 70% of individuals. So that's why we want to talk about sleep hygiene, which are essentially some tips that have been found to be helpful in promoting sleep and restfulness through healthy behaviors. One thing we want to note is that instead of forcing sleep to happen, we do want to teach our body to invite sleep to occur. So it should be a welcoming feeling instead of a pressurizing activity. All right, and with that said, let's see if we're able to troubleshoot the technical side. We want to kind of gather like what are your sleep difficulties after the brain injury? It could be insomnia, hypersomnia, sleeping too much, remaining asleep at night, or having difficulties with remaining asleep at night, daytime sleepiness, sleep apnea, narcolepsy, and limb movement disorder, like restless leg. Yeah, all right. So I see the majority of us responded. So let's take a look at the results here. Looks like the majority of the group do find difficulties with, staying asleep at night. So having fragmented sleep and also having daytime sleepiness. And I would say that's very consistent with some of this, the data that we see on a national level too, because those are the key primary sleep complaints that people would bring up after a brain injury. Sleep apnea, not narcolepsy, and limb movement disorders, like these are more rare, and those would also include like a more detailed assessment from your doctors, for example, like a sleep study. So yeah, thank you for participating in the poll. All right. Okay. So let's talk about insomnia first. So we find that developing a nightly routine is always helpful. We actually recommend a 30-minute winding down period for the brain. So during that time, we can start to like dim the lights. We can unplug from electronics and try to engage in certain relaxation methods, such as like meditation, deep breathing, imagery exercises that your therapist can recommend. If you cannot fall asleep after 20 minutes in bed, our recommendation is try not to toss and turn. This is based on like a stimulus control theory where we want our body to recognize that the bed is for sleep only. So if we're wide awake in bed, it's actually best to leave the bed and only come back when we feel tired again. We want to debunk some of the myths about sleep to kind of remove that extra layer of worry. So for example, we might think, oh, sleep deprivation for one day is really detrimental to health. So this is not true. Or some people might think, well, it's better to sleep a lot, or it's better to sleep more. That is also not true. And actually, as shown by science, our body only needs like an adequate amount of rest. And in fact, sleeping too much can sometimes be an indicator of like other long-term health issues. And it's really important to also be compassionate to yourself and try not to like force sleep onto yourself. And now about like frequent awakening during sleep, which was one of the things that was endorsed in our poll. Now that's a very common issue after brain injuries too. So the key here is to have a plan to relax when waking up in the middle of the night. You want to consider this to be like a relaxation or self-care me time. So don't be harsh on yourself and think, oh no, here we go again. Instead, you can think, oh, okay, I can still use this time to relax my mind, relax my body, and my body has the ability to cope and adjust. Again, just no toss and turns in the bed, just relax quietly, maybe read a book, or like listen to some soft music, and only return to bed when you feel sleepy enough. Don't look at the clock because it's going to trigger the unnecessary anxiety. Again, we want to dissolve some of these unhelpful thoughts about what optimal sleep could be. We also want to acknowledge that some sleep issues or sleep problems can gradually subside as our brain heals. We want to be compassionate towards our body and listen to its needs instead of forcing it to act in a certain way. If we didn't get enough sleep the night before, try not to overdo it with naps the day after. We say that effective power naps are usually not more than 20 minutes. We don't want to enter into the deeper stages of sleep cycles, as it will kind of make it harder for us to wake up later. We also want to do naps earlier in the afternoon. So like maybe before like 3 p.m. or even 4 p.m. So some healthy lifestyle habits can also promote better sleep. So for example, getting daylight exposure can help our circadian rhythm, like some of the clock cells in our body, to be more in sync with the external environment, kind of promoting sleepiness when it's dark later at night. We want to be physically active during the day. We want to reduce our alcohol, caffeine amounts, and do not smoke. Eat an early dinner to avoid acid reflux. And again, with stimulus control theory, we want to restrict any in-bed activities. So just learning that the bed is only for like relaxation, with the exception of like sex activities. And next is to optimize our bedroom environment. So we want to make sure that we have a comfortable mattress and bedding. A cool temperature is usually helpful to help us sleep because our body temperature also drops while we sleep. We can block out lights with any blackout curtains or eye mask. We want to minimize noise in our sleeping environment. And some people like to use calming scents such as lavender to help like calm our senses. Right, so those were all the different sleep hygiene tips that we felt could be useful to promote better sleep. So next we want to transition to talk about emotion regulation. So these are some of the happy neurotransmitters that promote positive feelings for us. So those include dopamine, oxytocin, serotonin, and endorphins. Now we know that depression and anxiety after ABI are actually very well documented, and that's why we feel that it's important to talk about emotion regulation. And in fact, again, like some of the research findings here is that, like a lot of researchers actually found that post-injury anxiety, they actually predicts our real life emotional and cognitive functioning better than, a single like cognitive test score. So it's really important to look at the role of anxiety and depression in our lives. And also when it comes to analyzing what factors that contribute to successful rehab, a lot of the studies have actually identified that our attitudes, our motivation, and also our emotional factors, such as like our confidence level, our self-esteem, they're all important factors that kind of play a part in promoting successful rehab. Let's learn a little bit about the brain. So our brains are more susceptible to negative emotions after a brain injury, and they can come out especially when we're presented with challenging problems or decisions in daily life. Because first, we may feel sad over our physical and cognitive losses. There would be anger about injury or perhaps anxiety about the future. So just overall, we have a higher than baseline levels of the emotionality. And then at the same time, we also have a reduced capacity for attentional and emotional control because of some organic changes inside the brain. So together, it kind of makes it more difficult to perform emotional regulation. So in the upcoming slide here, we want to know, like, what are some of the negative emotions that you might have experienced after a brain injury? So here we have a few reactions. And also keep in mind that these are just of the more like common emotions that we encounter. So I'm listing them here. They're by no means like reflective of other possible subjective experiences. And sometimes we could have more than one, like one reaction as well after a brain injury. Okay. All right. I see that the majority of us have answered. So why don't we take a look? All right, okay. Yeah, it looks like the majority of us picked nervousness and anxiety. And then there's also some endorsement of sadness. Okay, yeah. And these are as well like some of the key or the primary reactions that were endorsed by the population as well. Okay. I'm gonna stop share. Okay. So with that said, we actually want to use the second half of our webinar today to introduce the problem-solving therapy approach to kind of address some negative thoughts and moods that may come up after we experience a brain injury. So the brain is a very interesting organ. It's always constantly looking for connections. So when things don't really go well in our lives, or even during rehab, sometimes we develop these maladaptive assumptions, beliefs, and expectations regarding our own experience. In fact, even before any brain injuries, we all encounter problems in our lives like every day. Sometimes it's bigger, sometimes it's smaller. And when problems don't get resolved, they start to pile up and it can feel overwhelming. But usually when we find a way to get a handle on a problem and take a step to solve it, we start to feel better. So in that context, when we use problem-solving therapy in cognitive rehab, it is kind of like an approach to help us deal with problems so they don't feel so overwhelming. If we take a look at the red box here, problem orientation, it essentially refers to our own set of response, attitudes, and our views of a situation. And it can be negative or positive. So yeah, so psychologists, we like to look at how we look at problems. So there are 4 different ways that we approach a problem. So first of all, let's see, oh, where's my cursor? Oh, okay, sorry. All right, so first of all, in the orange box, we see problem attribution. So that really refers to like what or who you attribute the problem source to. Is it external or internal? And just a lot of times it can cause a lot of self-guilt if it's internally attributed. Or a lot of times if we only attribute some of our difficulties to just the brain injury, it can cause us to feel very self-conscious, and it can kind of persist that sense of loss. And we'll have more examples that Dr. Adams will walk through with us later. But before we do that, just a very brief description of the other boxes. Problem appraisal, the gray box here, it refers to whether you see problems as obstacles or growth areas. In the yellow box, perceived control, it refers to whether you think a situation is fixed or the situation is actually changeable. And lastly, time, effort, commitment. It refers to whether you feel it's worth the investment of your effort to engage in certain cognitive strategies or some of the tips or advices that your rehab therapist shares with you. So for example, it could be taking time to do pacing, or even like for slower processing speed, like whether it's worth it to do the time pressure management strategy. So with that said, Dr. Adams is going to give us some examples to illustrate what they mean, and then later Dr. Krapp will go through the steps of problem solving with us.
Thank you. So back to kind of the last few details you were giving from the previous slide, the idea of how we attribute what we attribute these challenges to. How do we define our self-worth or our success or our failures? So noting our negative self-talk, and we have an example of a client here, this mock client character here in his 50s, 9 months after an acquired brain injury. He's a realtor. And, one idea that pops into his mind, a bit of negative self-talk, is I should have a strong memory despite my TBI. If I don't, I'm a complete failure. So we see that there's significant attribution of his sense of self-worth, his success, to his ability to carry out work as he did prior to. So if we look at him as an example and picture perhaps some of the testing in his early assessments, neuropsychological assessments after his injury or prior to his injury, we'll notice that after we see a reduced ability to use visual space, to focus his attention, auditory attention, what he's hearing, let's say from a client as a realtor, and even verbal exchange memory. So the idea is prior to perhaps he had really high scores in abstract reasoning and his ability to make sense of the landscape of a house, let's say as a realtor, or listening to a client. And so if we know that prior to his injury, those were all things that were fairly easy to him. And post-injury, he's actually struggling, just a bit of a time delay in a handful of areas perhaps, that he would use, let's say, some rehabilitation, some cognitive rehabilitation focused on perhaps some cues or strategies, and eventually trust in his own ability to move forward. So we notice that in the slide shown here, the more positive comment could be, it's not my fault that my memory is weaker after this injury. It's okay for me to use these aids or these strategies. So essentially dialing down the worth that's then attributed to his memory and his sense of self and his work environment. And then using these external aids to trust that he's making progress in this interim phase while he's healing. Mm-hmm. And so our next slide is essentially this perception. The appraisal, is rehabilitation an obstacle or growth? And so keeping a notebook and calendar is a daily reminder of my disability. So it's a little bit more of looking at this rehabilitation as a challenge, as an obstacle, that I'm reminded of this and it's painful. But if we look at it as a growth, one thought he might encounter would be a little bit more positive one around this idea of using the planners, the notebooks to help him heal just as an aid right now, getting in the habit of this perhaps till he becomes more independent and free of them. So one idea to use or consider is getting greater benefits of toggling and waiting and resting. For example, back to the graph that Dr. Choi had used where we showed the green zone, yellow zone, and red zone. So the idea that in a relaxed state, you're certainly more calm and capable of attending to material before you. So for example, as a realtor, if he's attempting to listen to a client and he's distracted by this negative monologue, he will likely not hear what they say. But if he feels grounded and he was able to check the to-do list or questions preemptively, perhaps that this client has, he may stay in that relaxed state, be better capable of attending to the information shared with him, and then remembering it. So as we can see, it starts a little bit more of a positive upswing, a positive cycle of trusting that the rehabilitation is happening and that this is a growth phase, that while challenging is doable and possible. So really kind of leaning into that appraisal more positively with the example there. And using this idea of greater benefits if you pace yourself from the pacing, or greater benefits if you're appraising the scenario as a growth edge versus obstacle. But these are sort of carrots we can use to remind ourselves, to set ourselves forward on the path. And so the next slide then would be, when your negative emotions are activated, how do you not lose sight of your progress? So the perceived control square that we saw a couple slides back, this idea of, is this problem solvable or is it unsolvable? And so when we think of the perceived control of, oh, this is solvable, it's challenging or tiresome, or the more positive lens, perhaps, let's say, of this happens and this may be difficult, but I've done this before. Or when I check my calendar, I succeed. The more challenging negative thoughts that can persist are, oh, I always get so flustered doing this because I'm brain injured. I'll never be able to do this, or this will never change. So we just kind of notice the two sides of it, that if we can stay again in that relaxed space, that we stay with it being more solvable, with that when we become flush with negative emotion, it's more easy then to kind of fall into the pothole of unsolvable. And this is where we really want to build kind of some scaffolding, some reminders, again, back to the carrots. So when we know we're going to be overwhelmed perhaps by negative emotion, what can we do? So even noting to yourself, if you know, let's say Mondays are stressful for you, or if there's a day that's coupled with work and family obligations, that's going to be a day where perhaps we have some more vulnerabilities. So I think it's really important to kind of take note, like you did in the earlier slide, of how you feel in the green zone, how you feel in the yellow zone, and when you know you're approaching the red zone. So really kind of just assessing your underlying vulnerabilities. Have you had less sleep, like we talked about prior slides? Is it a more stressful day? Is there something coming up for you that's leaning toward the negative? Yeah. And then this last one on time, effort, commitment. So essentially just the idea that when you know you're putting in time and effort as a commitment, it becomes an investment, and you trust that this eventually leads to growth, or this leads to improved performance or more positive cycling upward. So when a solution's not immediately apparent, how do you stay with the bigger goal that you are healing? So kind of like I was mentioning, this idea of noting when you have underlying vulnerabilities and kind of stacking the deck in your favor. So do you need more breaks that day in pacing? Can you tell yourself you're going to offer something that's soothing the end of the day, in the evening? A hot bath, or perhaps going to bed earlier if you didn't sleep well. So the idea of kind of sticking with this bigger focus, even when you lose sight. And so, for example, the two brackets that came up here, a good memory should come naturally to me. I shouldn't have to struggle with writing every appointment down, keeping everything so organized. So if we think of our example of the realtor, perhaps he's easily overwhelmed that he still has to use these external aids. But the idea is the more he continues to stick with these, however burdensome, the more consistently he can commit and put in the effort. He can notice and trust and begin to appreciate that he is making progress and that he is moving toward the growth edge or the healing edge that he needs to feel more himself.
Yeah.
Yeah, and anything else you'd like to add to that one? But yeah, to that set of those.
Yeah. I think, when it comes to having like a different perspective, right? One thing that we like to start with, in this conversation is to think about like what might be the benefits really to actively engage in rehab and utilizing the cognitive strategies. Like what might the benefits look like for you? And we can start there as a motivation. And again, we don't have a poll activity for this, but I feel like, or we feel like this is a good starting point. And this is a question that you can, take home or take to your next session with your therapist and kind of like think about this in your free time as well. And with that said, I do want to pass time. Oh yeah, so name a few positive outcomes. So with that said, I want to pass the time to Dr. Crabb to lead us through the problem solving steps here.
All right. So let's talk about the steps to problem solving. So these steps are the steps that I use when I teach problem solving therapy, which is, as we've been talking a little bit about, it's this really straightforward therapy approach to help people better resolve life problems in order to resolve their depression and anxiety and regain confidence. So these steps are really the steps that people use naturally when they're solving problems that they feel reasonably confident about. But what we find is that problem solving ability breaks down when people are overwhelmed, stressed, or depressed. Individuals with brain injury are even more vulnerable to feeling overwhelmed because of the extra demands on cognitive reserve. And so we find that folks who have experienced a brain injury can especially benefit from just having these really clear steps to problem solving. So it's kind of making explicit what is usually implicit. So people usually have the response that, yeah, these steps are this is kind of obvious, but what I usually find is that it's all about the application. So let me just talk you through the steps here. And what I usually first have people do is to make a brief list of the problems that are concerning them the most. So really just kind of getting everything down. What's the universe of problems that we're concerned about? And then from there, it's just picking one at a time to work on. And sometimes for a first problem to pick, I have people pick not the most difficult problem that they're working on, but something that actually feels a little bit solvable. So we kind of go for the low-hanging fruit to try to build up the momentum with problem solving and regain confidence. So once we've got a problem in mind, then we talk about defining the problem. So that means to understand it and break it down. So we always want to really understand what's going on first before we get to solutions. If anybody has ever had the experience of having a problem and then talking about it to somebody and having them jump in with, well, have you thought about X? That's what one of the things that we're really trying to avoid with these problem solving steps is kind of jumping to solutions or getting stuck and feeling like there's no solutions. So it's really taking the time to define and really understand those problems first, and then set a goal about what you want to see change. Where do you want to get to? If this problem wasn't a problem, what would be different? From there, it's brainstorming a list of what are some possible solutions, some possible ways to reach this goal or these goals. You can have more than one. And then weigh the pros and cons of each one. Which one is best? And what are the drawbacks? And then we create an action plan. And what I do if I'm doing this with a client is we create a really clear step-by-step action plan. And then that person will go and do that action plan in between sessions and come back and talk about it. And okay, how did it go? What worked? What didn't work? Can we troubleshoot it? And what did you learn about the problem? And then it usually is sort of this iterative process where it leads to, okay, what's next? What's the next action plan I'm going to make? Especially if we're dealing with a problem that's a little bit more complicated or takes more than one session or more than one try to break it down. So let's look at an example of a problem. Okay, so here are some examples here. And maybe before we look at I'll lead us through a specific example, but maybe just imagine a problem that's occurred for you or for the person that you're caring for as we think about using these steps. So it could be any of these ones here: difficulty keeping track of medical appointments, being late to appointments, finding it difficult to initiate doing chores or other important tasks, feeling isolated, anything you can think of. And just take a moment to just kind of imagine, could you imagine using these steps to break down a problem? And then on the next slide here, I'm going to take you through the steps. So the problem is late to appointments. That's the problem that we've chosen. And as we break down the problem, I would ask that person, I wouldn't just sort of go late to the problem. Okay, so what's the goal? Be on time. Well, let's understand a little bit. What happens when you're late to the appointments? And so that would be, then maybe the person explains, well, I actually get really overwhelmed on the day of. And I find myself doing all sorts of extra things, just getting kind of flustered and nervous, not feeling organized. And then I end up being late and I feel bad. So now we understand the problem a little bit better. So the goal, or the goals rather, that this person chose is, I want to be on time to my appointment this week. That's, the really concrete goal. And then there's kind of an emotional goal too, which is I want to be less stressed. I don't want to feel so stressed and rushed getting to this appointment. So with the goals in mind, then we're able to brainstorm some possible solutions. And so those could be, okay, I'm going to set an alarm 1 hour before this appointment. So that's when I start getting ready and getting all my stuff together. So I've got a nice long runway before I even go out and get in the car or call the Lyft or Uber or, or get on the bus. Other ideas, I could ask a friend to go with me. Maybe it feels easier to have kind of an accountability buddy or somebody to help you get there. Move the appointment to later in the day. Again, we're brainstorming, so we kind of put down anything we can think of, other ideas, get things all ready the night before, and then maybe take something like one of the ride shares instead of the bus. So in this case, the person chose a couple of different solutions, and those were, okay, I'm going to prepare my bag the night before, get everything ready, get my healthcare card, get a snack for the day, have everything right there. And I'm also going to do that thing where I set the alarm so that I know that I've got that runway. I know that I've got so much time to call my ride. And that's what I'm going to do. And then the action. So then there might be some specific action items that we put through. How are you going to make sure that this takes place? And so that might be, for example, okay, well, I'm going to set that alarm on my phone. Maybe that's even something that you could do right now in the session, rather than have to wait until, if you know when your appointment is coming up. Or maybe it's when I get home, I'm going to take out the things that I need for my appointment next week to be sure that I know exactly where they are. I'm going to practice this. And then it could be carrying through this plan on the day. And then I would say that one sort of final action step is always the, evaluating the plan afterwards. Is, how did this go? And what did I learn about how this kind of plan works for me? So then we can always be flexible, and we can take pieces of that plan that worked next time and do them again. And we can shift the pieces that didn't work, or we can add in another piece. Okay, next time I'd actually like to have a friend go with me. So lots of different options. Okay, so that is a very brief introduction to problem solving therapy.
Yeah. Thank you, Dr. Kraft, and also for Dr. Adams to go through both pieces with us. I do feel that, in my clinical experience, this therapy does address both the cognitive piece of encountering problem and also just taking actions, and also the behavioral piece of, making things happen. So definitely very effective approaches to kind of problem solving bit by bit, as different challenges and growth opportunities come up in the rehab process. I do want to, kind of lead the group through the last section of our webinar, which is focused on the prevention of brain injuries, because according to a nationwide study, actually, that's very recently published last year, the researchers found that about 8% of individuals reported kind of sustaining a re-injury after the initial injury. And among those, 20% of re-injuries actually occurred within a year of the initial injury. And some predictors of re-injury would include a younger age, below 29 years old, or middle-aged and older, so 50 years old and older, alcohol and drug use, and perhaps actually having mild levels of TBI, possibly kind of related maybe to the lack of knowledge and awareness to the subtle cognitive inefficiency. So for example, our attention and some of the and the processing speed could be impacted. So it kind of like makes one more vulnerable to, it kind of reduces the awareness to some of the threats and some of the warning signs. So we thought it's helpful to kind of end the webinar on this note to share with the group some information about how to prevent future brain injuries. So some safety tips here. We want to avoid distracted walking, so be careful when walking and texting. When you're using headphones or talking on the cell phone, going back to the attention model, we always want to do just one thing at a time. We can make our living areas more safe by removing tripping hazards, installing or placing non-slip mats and grab bars in slippery areas like bathtubs, shower, and we can install handrails on stairways, and we can increase lighting in our moving space. So these can all be discussed with a physical therapist and an occupational therapist. We want to know which medications can make us feel more dizzy and sleepy, so you can plan your activities accordingly. We want to limit exposure to any environmental toxins such as mold, asbestos, paint, and avoid like large construction sites, nail polish, like strong perfume, anything that kind of reduces chances of like inflammation, infection. We want to check your vision and hearing to make sure they're adequate so we can pay attention to our surroundings. Always wear a helmet when biking or when engaging in certain sports. So some of the high-risk sports to be aware of include skiing, snowboarding, horse riding, baseball, softball, because we're carrying the bats, riding a skateboard, or just any contact sports like ice hockey, boxing, and football. And we do know that we have like some active folks here. So for those who wants to get back into sports with confidence and safety, you want to get the support from your rehab team to get some tips and advices to do that. So other tips here include, we know that summer and the swimming pool is not, it's kind of close by. So definitely do not dive, as it can create shock waves to the head region. We always want to enter feet first into the water. Always buckle up, wear seatbelts when you drive or when you ride in a car. And never drive under the influence of alcohol or drugs. This is actually the most common reason for people getting back to re-injuries. And again, no distracted walking nor distracted driving, and no drowsy driving. So like feeling tired, we want to pull over and make sure that we're well rested and we have enough attention before we head back onto the road. So actually on this note, I think that reaches the last slide that we have for the webinar. I just want to, thank you everybody for participating and also being proactive. So with that said, I guess we can, transition to